149 Aphorism Organon of Medicine. In the fifth edition it is as follows: when the suitable homeopathic remedy has been thus selected and rightly employed, the acute disease we wish to cure, even though it be of a grave character and attended by many sufferings, subsides insensibly in a few hours if it be of recent date, in a few days if it be of a somewhat longer standing, along with all traces of indisposition, and nothing or almost nothing more of the artificial medicinal disease is perceived, there occurs by rapid imperceptible transitions nothing but restored health, recovery. Diseases of long standing, and especially such as are of a complicated character, require for their cure a proportionately longer time; more especially do the chronic medicinal dyscrasia, that is an abnormal or disordered state of the body or body parts, so often produced by allopathic mismanagement, along with the natural disease left uncured by it, require a much longer time for their recovery, often indeed as they are incurable, in consequence of the shameful robbery of the patient's strength and juices, the principal feat performed by allopathy in its so-called methods of treatment. Footnote: but this laborious, sometimes very laborious, search for and selection of the homeopathic remedy most suitable in every respect to each morbid state is an operation which, in despite of all the admirable books for facilitating it, still demands the study of the original sources themselves, and at the same time a great amount of circumspection and serious deliberation, which have their best reward in the consciousness of having faithfully discharged our duty. How could this laborious, care-demanding task, by which alone the best way of curing diseases is rendered possible, please the gentlemen of the new Mongrel Sect, who assume the honourable name of homeopath, and even seem to employ medicines in form and appearance homeopathic, but determined upon by them anyhow, whatever came to his head, and who, when the unsuitable remedy does not immediately give relief, in place of laying the blame on their unpardonable ignorance and laxity in performing the most important and serious of all human affairs, ascribe it to homeopathy, which they accuse of great imperfection. If the truth be told, its imperfection consists in this, that the most suitable homeopathic remedy for each morbid condition does not spontaneously fly into their mouths like roasted pigeons, without any trouble on their own part. They know, however, from frequent practice, how to make up for the inefficiency of the scarcely half homeopathic remedy by the employment of allopathic means that come much more handy to them, among which one or more dozens of leeches applied to the affected part, or little harmless venesections to the extent of 8 ounces, and so forth, play an important part; and should the patient, in spite of all this, recover, they praise enthusiastically their venesections, leeches, claiming that had it not been for these the patient would not have been pulled through, and they give us to understand in no doubtful language that these operations, derived without much exercise of genius from the pernicious routine of the old school, in reality contributed the best share towards the cure. But if the patient die under the treatment, as not unfrequently happens, they seek to console the friends by saying that they themselves were witnesses that everything conceivable had been done for the lamented deceased. Who would do this frivolous and pernicious tribe the honor to call them after the name of the very laborious but salutary art, homeopathic physicians? May the just recompense await them, that, when taken ill, they may be treated in the same manner. Section 149 is wholly rewritten in the sixth edition, and it is as follows: diseases of long standing, and especially such as are of a complicated character, require for their cure a proportionately longer time. More especially do the chronic medicinal dyscrasia, so often produced by allopathic bungling along with the natural disease left uncured by it, require a much longer time for their recovery. Often indeed are they incurable, in consequence of the shameful robbery of the patient's strength and juices, venesections, purgatives, etc., on account of long continued use of large doses of violently acting remedies given on the basis of empty, false theories for alleged usefulness in cases of diseases appearing similar, also in prescribing unsuitable mineral baths, etc., the principal feat performed by allopathy in its so-called methods of treatment.